Mpox, previously known as monkeypox, is an infectious disease caused by the monkeypox virus, obviously, belonging to the Autopox virus genus, right? And the family of Poxviridae, which also has viruses like smallpox closely related to them. Therefore, the symptoms that you get is also highly similar. The Mpox virus, right, can be divided to two clades, clade 1, clade 2. Basically, clade 1, is endemic at Central Africa, while clade 2 more to West Africa. Right? The differences is that clade 2 is not as virulent as clade 1. Clade 1 seems to be more than 20% more, roughly, much more virulent, much severe, with a mortality rate of close to 10%. One of the lessons learned from COVID-19 is that in less than a week, when first the Omicron variant was announced in China, and in less than a week we had a global outbreak of Omicron variant, right? That's how fast infectious disease can spread, especially something which is highly transmissible as this. Right? And if you look at the transmission dynamics, right, it's somewhat similar to COVID-19. So, mpox can be transmitted through fomites, through touch of infected material. It also can be transmitted through respiratory droplets. It is very efficient human-to-human transmission, where if you have skin lesions, if you are contagious, when you touch another person, and you can transmit the virus. It is sort of a perfect virus to be transmitted, especially when you have traveling connecting flights, and you look at Asia, Indo-Pacific, it is the point of global connectivity. And obviously, because of that, you will see cases, spiraling soon. This is not to create fear, but this is the fact of the matter, and we must be ready for this. We also know that previous sort of weapons or defenses that we had against COVID-19 worked. You can only transmit the virus when you're contagious, when you see the symptoms, when you have the lesions, when the lesions break, right? So you have time. So obviously you must take care of social distancing, masks help, obviously N95 masks help, proper hand hygiene helps. Whatever we have practiced for COVID-19 applies here, at least at the community level. Obviously government should play much more role looking at surveillance, looking at incoming flights, looking at people with fever, people with rashes. And one good thing is that we have vaccines which work from above 60% to 90% of protection, correlate of protection, depending on the community that you're looking at. Another problem is that with vaccines, can we distribute vaccines evenly, especially in areas where it's much needed, especially in Africa, where they don't have much vaccines. I understand that the vaccine makers are ramping up production. You're looking at 10 million doses. I'm hearing there are much more severe effects for countries which are not prepared for this, which don't have a robust healthcare system, right? Before 2022, monkeypox or mpox was fairly endemic, was fairly contained. And now you have cases in Sweden, you have cases in Pakistan, you have cases in Indonesia. So it really shows that it's a matter of time before it spreads. I think there are 3 approved vaccines. You have the Jynneos, you have the ACAM2000, and also you have the LC16 made in Japan. And these vaccines were originally intended for smallpox. Thanks to the cross-reactivity between antibodies to Autopox virus family, it also works well for mpox. The only problem is that these vaccines against smallpox were never meant to be mass-produced. So these are sort of traditional vaccines where it uses replication-deficient viruses. So technically, theoretically, it takes much more longer. So the only problem is now ramping up production and distributing it towards countries which needs it most. If you ask me, it's better to protect Africa where the disease started, rather than stockpiling the vaccines from us. There is a fear that we're going to get the disease, but it's much better to stop the disease from spreading. This is the age of viruses. This is not going to be the last sort of epidemic or pandemic, right? Similar to COVID-19, we are going to get much more viruses thanks to zoonosis, right? Spillover from animals to humans. And because of urbanization, because of globalization, looking at climate change comes into play, it's inevitable. The lessons learned from COVID-19, I know I'm keep on saying this, it's extremely important. Equitable vaccine among countries. Public health education is extremely important. It should be part of the syllabus in schools, if you ask me. It's better to get ready. It's better to be safe than to be sorry.